In the human, about age 10, hormones start causing a lot of changes to occur. Puberty is the period when the secondary sexual characteristics begin to develop, and of course it's at that time that you have the potential to reproduce sexually or to create offspring. So the beginning of puberty is marked by really intense bursts or pulses of follicle stimulating hormone and luteinizing hormone, and each of these is going to be triggered by gonadotropin releasing hormone. So these pulses usually occur during sleep, and this can lead to some of those nocturnal or nighttime erections during puberty in males. But as puberty continues, the hormone pulses occur during the day as well, and these pulses increase in frequency during a 3 to 4 period until the adult pattern of sexual secondary characteristics and sexual maturation has occurred. And if you look at this image, you can see some of the changes that will occur in the male: testicular enlargement, an increase in the length of the penis, and the ejaculation begins to occur, the development of pubic hair, the changes in the body composition to where the waist typically becomes slimmer and the shoulders become broader, and an increase in lean muscle mass, bone growth, so there's a growth spurt during this time as well. Females also usually have a growth spurt, but develop the breasts develop during this time, and fat becomes deposited in different areas of the body, leading to a more curvy appearance in the female, and then of course the development of the pubic hair. And as puberty continues, the pattern of hair development continues in both sexes, where you have the underarm hair increases in both males and females, and then of course in the male the typical hair pattern of the beard and facial hair and chest hair and increased hair on other parts of the body continues as well. But we continue to age, and the female reproductive cycle just normally occurs about once each month from menarche, or when the first period, the first menses appears, to menopause, and that's when you have the complete cessation or stopping of the monthly menses. So the female reproductive system has a limited time span of fertility and able to reproduce, and that is between menarche and menopause. So for the first 1 or 2 years after menarche, the ovulation only occurs in about 10% of the cycle, so it's very irregular, and the luteal phase is very short. Gradually, the percentage of ovulatory cycles increases though, and the luteal phase reaches its normal duration of about 14 days after about that 2-year period. With age though, fertility declines, so somewhere between the ages of 40 and 50, the pool of the remaining ovarian follicles in the oocytes diminishes greatly and becomes just completely gone. We use up all those eggs, right? So as a result, the ovaries then become less responsive to the hormones that would normally stimulate them. So the production of estrogen is going to decline, because if the follicles are not maturing, then the follicles are not producing the high levels of estrogen. So the FSH and LH are going to be secreted in much, much higher levels, because there's not that negative feedback that you would get from the high levels of estrogen. So this can cause a lot of women to experience hot flashes and heavy sweating when those high levels of gonadotropin releasing hormone happen, to cause more FSH and LH to be secreted, but it's getting, again, no negative feedback, right? So other symptoms of menopause other than the hot flashes are headaches, hair loss, muscle pains. Some women experience vaginal dryness and insomnia, depression, weight gain, and the all popular mood swings. Sometimes there is atrophy or decrease in mass of the ovaries, the uterine tubes, the uterus, the vagina, the external genitalia, and the breast as well. All of this can occur in the postmenopausal women, or the women that have experienced and completed menopause, or in the later stages of menopause. The estrogens, remember, also help to cause women to have the normal bone mass, but when those levels of estrogens decrease, a lot of women will lose some of that density of the bones and can develop conditions such as osteoporosis. The lower levels of estrogen can decrease the sex drive, which we commonly call the libido. But sometimes the adrenal sex hormones make up for that. Other women don't have a risk or don't have a decrease in their sex drive at all. The risk of having uterine cancer peaks about 65 years of age, but cervical cancer is more common in younger women. Now, in males, on the other hand, declining reproduction is much less early. Okay, so males will continue to produce sperm cells throughout their lifespan. They can retain a healthy reproductive capacity well into their 80s or 90s, as long as testosterone levels stay high enough. But those levels do tend to decrease as they age, but most men will produce a few viable sperm on a continuous basis, but may, as the testosterone levels continue to decrease, may also have a decreased sex drive. So the sperm production usually decreases by about 50 to 70% between the ages of 60 and 80. But not in all men, right? Some continue to produce normal amounts of sperm or almost normal amounts throughout their lifespan. One change that does occur in most men over the age of 60 is that the prostate gland begins to grow, and sometimes to 2 to 4 times its normal size. And this develops a condition called benign prostatic hyperplasia, which simply means the prostate is growing greatly, but it is not a cancerous condition. So once this happens, of course, remember the urethra runs through the prostate gland. So as the prostate gland is growing, the urethra becomes restricted, as that tissue is basically cutting off the ability for urine to flow through. So this leads to the urge to have more frequent urination because the bladder is not emptying completely. It can also lead to urination at night during sleep, or decrease of force of the urine stream, dribbling, as they say, where urine just sort of dribbles out, and also just the feeling of incomplete emptying of the bladder. And then, of course, as we do with most of the chapters, I want you just to be able to look over the homeostasis as related to the reproductive system and how the reproductive system works with other body systems. So let's just take one here at random. Let's go with the muscular system. So androgens, sex hormones, male hormones stimulate the growth of the muscular system. The respiratory system, during sexual arousal, the rate and the depth of breathing increase. Endocrine system, boy, that one should be obvious, right? Testosterone, estrogen, luteinizing hormone, follicle stimulating hormone, gonadotropin releasing hormone, right? The integumentary system and the reproductive system. Well, think about what happens. You start developing all this new body hair, the deposition of fat changes, the mammary glands produce, the skin stretches during pregnancy. So, as we've talked about before, all body systems work together to maintain homeostasis of the organism.